patient had been working with one of the adult doctors and had kind of just encountered a plateau in her recovery and was looking for other options to regain some function. And so, the other physician had reached out to me to see if this other intervention might help her continue and make some progress with her recovery, and maybe gave us, additional kind of therapy goals to work on. So this particular patient had a stroke, had undergone extensive inpatient rehabilitation following the stroke, outpatient therapy, had undergone botulinum toxin injections, and was continuing to have difficulty using the affected side. Her goal is really to get back to being able to fish, so stabilize her rod with one hand and turn the reel with the other. Because she'd already done a fair amount of rehab, we already had tried some injection therapies. There were limited number of tools still to pursue to engage in her recovery further, and the only thing that really we hadn't tried with her was a medication called Hylenex. So Hylenex is the brand name of a medication called Hyaluronidase. It's an enzyme that breaks down hyaluronic acid. We know in patients that have strokes, one of the things that happens is they get an overaccumulation of hyaluronic acid within the muscle. And because of the physical properties of hyaluronic acid, when there's a little bit, it acts as a lubricant between the muscle fibers, but when it's under pressure, it gets like stiff and thick like paste. And so the theory behind it is we sort of improve the muscle architecture to a point where, other interventions like Botox maybe are more effective. With this patient, she had initial improvement with botulinum toxin, but then really had plateaued. It didn't make sense to continue to repeat the botulinum toxin just because we weren't seeing a lot of clinical effect anymore. We hate to put somebody through the expense and the stress of a procedure if we're not really getting something adequate out of it. Botulinum toxin is a great tool. It really works the best when there's a very definitive kind of catch and release. So when the limb is just not moved through its range of motion much for a long period of time, you get this accumulation of hyaluronic acid in the muscle, and then it just gets to be really stiff and difficult to move regardless of the speed that you're moving it with. And so that's when I start to think about maybe augmenting the treatment with Hylenex. I usually start with sort of the smallest dose, least number of muscles. It's gonna improve the patient's dermatology. And so for her, we basically said if there was one muscle I could get to work better for you, what would it be? We just started with one muscle. And she came back the first day and she said, when I'm walking, people are noticing that my arm isn't held as high. It feels like I'm able to move the arm, more freely and more quickly. So that for her, I think really gave her a lot of hope that we'd see continued improvement with it. And it was enough to, pursue ongoing treatment. And I got a message from her therapist that it was, she felt like, she was already seeing some improvement from the treatment as well. So then we opted to treat the whole upper extremity. Anyone who does a lot of botulinum toxin injection sees that there's a fair number of cases that initially get a really good response. Over time, we kind of see the effect not lasting as long or not being, as profound. Having a tool that enables the botulinum toxin to work like it initially did again is really, really important. Some patients, when I kind of pre-treat them with Hylenex, I'm seeing enough improvement just with that I'm able to hold off on the botulinum toxin injections.